Welcome everyone to today's webinar, 10 Proven Ways to Acquire New Patients and Retain Existing Patients. I'm Marcus Robertson with Becker's Hospital Review. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a panel-style discussion, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to welcome today's speaker, Anmol Oberoi, co-founder and CEO of Emitrr. Anmol is the founder of Emitrr, a text message communication and automation software for healthcare businesses. He has over 5 years experience helping 1,000 plus healthcare practices grow their business with the help of automation and technology. At Emitrr, he is actively working with customers to improve patient experience with the help of automation. I'll now turn the floor over to Anmol to start today's presentation.
Great. Thank you so much, Marcus, for the introduction. And, I'm glad and excited today to share all my learnings with everybody who's attending. Hey, everyone. Thanks a lot for taking out time from your busy schedule for attending this webinar. Over the last 5 years, one thing that I have understood working with healthcare practices is that time is one thing that we always fall short of, right? Primarily because we know what's going on with, with I would say hiring and what's happening with the talent in the healthcare industry today. But hopefully this 1 hour will help you, identify those bottlenecks and help you grow further. So I'm really excited about this. I'm especially excited because we had over 500 plus people register for this, right? So that tells you that this is definitely an important topic, right? How do you acquire new patients and how do you sort of retain them with the costs of acquisition going higher and higher day after day, right? So a quick introduction about me. I started Emitrr back in 2018, an inspiration from a healthcare practice that is run by my relative, which helped me realize what are the gaps in healthcare businesses and where technology can really come in. Today we work with 1,000 plus medical practices. Just so you know that over 10 million plus messages are exchanged through Emitrr, both through automation and through communication. And our goal really is to help about 15,000 plus medical practices by the year end 2022. So let's dive right in. And I hope that everybody is going to find a lot of value in today's webinar. Now, we do have a lot of slides. And what I've tried to do is that I've tried to keep 1 slide per minute. So don't get scared by the number of slides. I promise you this is going to be very useful, and I'll not keep it boring, right? In the next 30 minutes, what I'll be talking about is how text messaging and automation can help you acquire new patients, retain existing patients, and keep your schedules full. Now, if you look at a healthcare practice, primarily those are the 3 goals that any healthcare practice owner sort of focuses on, right? That how do I keep acquiring new patients, retain existing patients, and how do I keep my schedule full at all points in time? I understood this very early when I was working with my relative in his healthcare practice, that these are primarily his 3 goals. And I tried to understand deeply how can I help him achieve those with the help of technology, right? And how I'm going to do this is I'm going to narrate a story of some of our customers, what we've learned from them, and how our platform and sort of our experience has helped them, acquire and sort of achieve these goals, right? But before we jump in, I want you to understand, I want to talk a little bit about what's happening today in 2022, right? Before we understand how you do that, it's very important to understand that the customer behavior is constantly changing. The last 20 years saw the rise of email, right? I mean, when Gmail came in, everybody sort of started using email. Now that behavior is changing very quickly. People have started moving from emails and phone calls to text messaging, right? So texting is the new email. And that's the sort of trend that we are leveraging today to help healthcare practices become better and better, right? Our research and our understanding from 1,000 plus practices tells us that over 50% of users will do business with the practice that responds to their inquiry first. So you got to have the first response time. I don't know how many of us today track first response times, but it's very much like sales, right? So you got to keep tracking your first response time. And 89% of users prefer to communicate with businesses via text over phone calls and emails. I'll tell you a recent story, right? I was speaking to a large healthcare practice just an hour back, and they asked me this question. They said that, hey, 50% of our patients are, I would say senior folks, and probably they don't use text messaging. And I asked them that, what's your goal moving forward? And they said our goal moving forward is that we want to have more and more younger population in our practice. And I said that, do you think the younger population will use phones and emails? And they said no. So essentially, that sort of helped them decide that they should be using a text messaging platform or texting as a channel to automate everything, right? So remember one thing, that texting has 98% open rates, and 89% of users who were surveyed said that they would prefer communicating via text, right? Now, this conversation is going to be relevant for you if you and your receptionist or your call center are always on calls, right? And if you're looking to streamline your medical office operations. If one thing that you feel is that we're depending a lot on human capital, but we want to depend a lot on technology and sort of reduce costs and sort of improve efficiency with the help of digitization, then this is going to be very, very relevant for you. And you don't have to take my word for it, right? 1,000+ practices, including people like Steve, think so, right? They think that text messaging, automation, and a lot of these things help practices become better and better, right? And that's exactly what's happening today. So that's exactly what I'm going to talk about. You can, of course, you're most welcome to read our reviews on Capterra to understand why healthcare practices are moving to technology more and more, right? Great. So let's talk about one last thing before jumping right in. Why text messaging, right? Apart from the fact that consumer behavior is changing, it's also important to understand that 95% of text messages are read within the first 3 minutes of being sent, right? And 97% of American adults text weekly. I'm sure that if I ask you this question, that you open up your phone right now and you look up your email, you look up your email app, Gmail, and if you look up your text messaging app, you'll see text messaging, the unread count most likely will be 0 or much lesser than 10, whereas emails, we'll all have thousands, right? Thousands of unread emails. If I open my phone, I'll see exactly the same thing, right? Doesn't that tell you something, that emails don't work for automation or for communication anymore, right? So having set that context, that automation is extremely important, and what's the channel to automate to sort of achieve these 3 goals? Let's jump right into the first goal that we're going to talk about today, right? Which is being able to acquire new patients. So that's essentially what we're going to talk about. And I'm going to talk about a couple of things which we've seen work really well to be able to acquire new patients, right? Starting with one of the most unique ways of acquiring new patients, which is probably an industry-first capability and something that I learned at my relatives practice, right? Let me tell you a backstory about the first capability, which is missed calls to text. I spent about 6 months with my relative trying to generate new patients for him through Google ads, through Facebook ads, and drive people through the virtual doors, right? And 6 months later, although the number of phone calls exponentially increased, the production or the revenue of the practice did not grow in line with the number of phone calls. We spent about a month to figure out what would be going wrong. And what we realized is that of all the phone calls, basically all the effort that we put in to drive people through the virtual doors, about 30 to 35% of the phone calls were never answered. I'm sure that rings a bell, that at a lot of practices, that's exactly what's happening, right? Because patients call after hours, on weekends, when your front desk or call center is busy. So that's the first problem that I'm going to talk about today, the way to acquire new patients from already existing demand, right? Which is missed calls to text. And I'm going to tell you what research says, right? So I'm sure all of us track this metric, how many calls are missed, how many calls are abandoned. If you don't, I would urge that today you go back and look at your calling software or your landline and see how many calls you're missing on a monthly or a weekly basis, right? Research indicates that every missed call costs you approximately $50 in revenue, right? So even if you miss 10 calls, you're losing $500. And 60% of the potential customers will go on and do business with someone else. I'd love to hear answers what has been your experience when a call is missed, and if you try to call back the patient, what happens? Do they say we've already gone somewhere? Do they not pick up the phone? Or if you experience something else, right? If this sort of rings a bell that, yes, that's exactly what happens, then I'm going to tell you a very interesting way to solve this problem, right? Essentially, how we solve this problem, I'm going to tell you a little bit of a story of a customer, right? So this is Mary Tilak and Associates. They are a large healthcare provider with 2 large practices and about 10,000 plus patients across these 2 locations, right? When we reached out to them, they knew that they were missing phone calls, but they did not know how many phone calls were they missing, right? Their phone system, which is landlines, they were using hard phones, right? And that's a thing of the past, in my opinion, today. You should use soft phones. They were using Comcast and these hard phones, and they didn't know how many calls were being missed. So there was a lot of revenue that was being lost, primarily because they were not tracking metrics altogether, right? When they started working with us, what they saw was that over 6 months, they missed a staggering 17,000 phone calls, right? 17,000 phone calls is a lot of phone calls, right? And that was almost equivalent to $400,000 worth of revenue. Now, they didn't know how to solve this because they didn't know, should we hire more people? What's really going wrong? I mean, even to solve the problem of 17,000 missed calls, you probably got to hire 20, 25 more people, right? And that's not a viable solution. So what did we do for them? We essentially started sending, we automated this, we automated a text messaging software, which what it does is, as soon as a phone call is missed, it would automatically send out a text message to the patient after playing a voice message saying that, hey, sorry, we're not available to take the call right now. You can respond to the text message and we'll get back to you, right? Now, what did this do? This did 2 things. One, we all know that the receptionists do not have the time to pick up the phone and dial codes to listen to voicemails, and that never happens, right? We also know that they do not have the time, rather it's not the best use of time to pick up the phone and dial everybody back. You don't know how many of these calls were relevant, right? So we started showing them how many calls were from landline, how many calls were from mobile, what did the patient call in for? Because they responded to that text message saying, I wanted to book an appointment, I wanted to refill, I wanted to sort of reschedule an appointment, so on and so forth. So it did 2 things, right? One, it automatically created an actionable conversation for every missed call. So there were no more missed calls. 2, it saved a lot of time because now receptionists could respond via text, which is one-to-many compared to one-to-one phone calls, right? And let me show you how that works. So what you see on my screen, the moment a call was missed, we would transcript the voicemail with 100% accuracy. A patient could say, I would like to speak to the doctor. We would send out a text message immediately after that, after playing the voice message. This is Mary Tilak, sorry, we missed your call. How can we help you, right? And if the patient says, I'd like to book an appointment, you already know that out of, let's say, the 20 or the 30 calls or the 100 calls that you missed, you can prioritize only the ones that responded and the ones that are from mobile, and you know exactly who's from a landline, right? So that's exactly what it did. And here are the results that we generated for them, right? So out of all of these 17,000 missed calls, 15% of these overall calls were for booking appointments. Now imagine if you lose 15% of this revenue, right? What could that cost you, right? In addition, it led to 40% reduction in incoming phone calls for prescription refills, right? Because they started seeing a trend that most of these missed calls were for prescription refill. They started educating their patients, saying that, hey, for prescription refill, you don't need to call us. You can go onto this app, download it, and request a prescription refill, right? And in addition, they saw an improvement of 30% in production, right, which is revenue. So you can imagine that you are easily losing about 15 to 20% or more of your revenue through missed calls. So that's the first thing, how you acquire new patients. You already have existing demand, and you essentially, what you do is, you sort of become more and more productive, more efficient to cater to that existing demand. So that's the first capability, or rather the first way to acquire new patients, right? Make sure that none of your phone calls are missed by automating text message responses to that. Let's come to the second capability. Now, the second capability is extremely, I would say, something that's taking off now, right? Like I said, the last 20 years have been about email. I'm sure all of you receive emails from a ton of different vendors. You receive emails from your EMR provider. You receive emails from different marketing companies, agencies. You receive emails from your insurance partners, etc., right? I want to know how many of these emails have you read, right, lately? I'm sure none, right? Nobody reads these emails anymore. texting is the new email, and that's the second channel that I'm talking about, right? Text message marketing. What email marketing did in the last 20 years, text message marketing is going to do for the next decade, right? So I already told you why text messaging, but let me tell you why SMS marketing, right? 55% of the people in America today use native messenger on the mobile device to send texts. If people don't use emails, then, and if they're on text, it makes a lot of sense to send them a text message for any communication or promotion, right? 91% of consumers would opt in for a text message from brands. So essentially, customers are saying that we will opt in to hear from you via text than email because I don't read emails, right? And text messages have 98% open rate, 45% response rate. Compared to email, which has about, I would say, less than 15% open rate and maybe less than 5% response rate, right? So that's essentially why you should be focusing on text message marketing, right? Now let's talk a little bit about the business challenges that our customers were facing, right? The practices that we work with were using emails, which had an open rate of 14% and response rate of 3%. Clearly, nobody was able to respond to them or hear their message, right? Everybody would tell them, yeah, I never got any message. When they would send messages that we have flu shots available, we have labs now, people would say, I was not aware, right? Because they were sending emails and calling people, right? Similarly, when they had to follow up on payments, they were doing that via email and phone calls. And we all know what happens with phone calls, right? People don't answer calls. If you ask me today that even if my own team called me, I'd preferably tell them, don't call me, right? Just text me. Texting is what I prefer. And 0% of their patients were reactivated through traditional methods, right? So essentially, none of their marketing / promotion channels were working. So what did they do? What did they change? They essentially started leveraging text messages, broadcast text messaging, right? So if you see here, this is a message that the customer sent. They said that, hey, this is Sarah from Emitrr. We have flu shots available at the Highland location. If you'd like to get yourself booked, you can simply respond to this text, right? In less than 3 minutes, they got a response saying, yes, please, I can come in tomorrow, right? Do you think that would ever happen via email? I'm next to sure that will never happen via email, right? So that's essentially why you should use text message marketing for bringing in your existing patients, reactivating them, telling them about promotions, telling them about new services that you have available, right? But let's talk a little bit about the results that it generated. 35% of the overall active communication with practice basically increased, right? So essentially they were getting 3% response. Now they started getting 35% response, right? The success rate of the payment follow-ups through automated SMS was 60%. So if they sent out 100 payment follow-ups, they received 60 payments out of those 100, right? You can imagine what that did to the practice from a production standpoint, right? And the practice spent a lot more lesser time, 90% lesser time with the help of SMS compared to phone calls. Instead of picking up the phone and saying, hey, Anmol, now we have a lab, now we have flu shots, we just wanted to update you, or sending emails, right? The system was able to do that through text. So that's, I would say, the second most important thing to keep in mind to acquire new patients, right? Keep in mind, missed calls and text message marketing helps you acquire new patients. The third capability that I'm going to talk about acquiring new patients is probably the most important of all of these two, right? It'll help you get new patients. It'll help you get discovered more and more, right? And that is nothing but reviews and reputation management. So just to set the context, essentially, I'll talk about two things, right? One is patient-facing reviews, why they're important. Two, why is it important from a perspective of ranking on Google, right? Now, 91% of the customers say they trust online reviews as much as personal recommendation, right? So if I was recommending a practice to you, it's almost equivalent to the online reviews that I read, right? And 90% of customers read online reviews before visiting a business. That should tell you that if today I had to find a practice near me, I would probably read reviews before finalizing who I should go to, right? So that's the first thing, that customers trust reviews. So you should keep focusing on your reviews and your reputation. You need to make sure that you're not getting too many negative reviews, right? That's from the customer / patient-facing side, right? What about from the Google side of things, right? Google cares about two things. One, your recency of reviews. What does that mean? Let me put things to perspective, right? That if you have 500 reviews and a practice that opened newly near you has just 50 reviews, And if that shows up above you on Google search, don't be surprised, because Google cares about the recency of reviews. Maybe your 500 reviews are 6 months old, whereas the 50 reviews are very recent for this practice, right? So Google's going to show up this practice thinking that, hey, patients are going there actively, so this is a more active practice. The second thing that Google care about from a reputation standpoint is, are you replying to these reviews actively? If you're not, that's a sign for Google that maybe this practice is not active, right? Especially if you get a negative review, it's important to manage your reputation, right? So how do you do that? Before I tell you how you do that via text messaging, let me tell you what were the challenges that were faced by our customer, right? And they have 10,000 customers. They should at least have given 10% conversion, 1,000 reviews, right? Less than 5% of their patients left reviews on the practice. They had 20 reviews when they came to us saying that, hey, reviews is one of the biggest challenges, right? They lost a lot of time because they had 2 locations. They had to provide the login details of Google My Business, Facebook to their team members, and people come and go. We know that. And then they would have to change their passwords and sort of keep them up to date and keep providing logins to different team members that, hey, can you respond to this review? So that's another challenge. They had 2 locations. They had to respond to multiple reviews, right? And maintaining their digital reputation across multiple platforms was a constant challenge, right? So that tells you they were not getting new reviews, and they were not managing their reputation because of multi-location, as well as multiple platforms. So what did we do for them, right? As soon as an appointment was completed, we did this for them, right? We automatically sent out a text message and email, multi-channel review request to patients, saying that, hey, thanks for visiting Dr. Tilak's office. Could you please take 30 seconds to leave us a review, right? That's essentially what we did. When patients clicked on this link, share your feedback, they were directed to a page like this. They clicked on yes. They could easily leave a review and a rating, right? Now, let me show you what that did to them. We started working with them exactly 4 months back on the reviews and reputation management capability. And these are the results today, right? When we started with them, they had 20 reviews. Today, they have 170 reviews in 4 months. That is almost 600x more reviews, right? And that's essentially why they're showing right on top of the search when somebody searches for doctor near Cherwell, right? That's exactly what it did to them. So now you can imagine that when it shows right on top, patients are going to click on that, pick up the phone and dial. And that's exactly what's happening to them, right? They are getting a lot more phone calls. So it's important to keep focusing on reviews and reputation to generate new to essentially generate new business and acquire new patients, right? So that's the third capability. And let me also talk about the impact. 27% of the average response rate to the reviews, basically it improved by 27%. Their average rating today is 4.7 from 2.2. And they're saving over 7 hours a week, right, at the practice with the help of automation. So that's the third way that you can increase your acquire new patients, right? Coming to the fourth and the last way to acquire new patients, I'm talking mostly about only the most important capabilities, right? Now coming to the third and the fourth capability, I want to ask you, and you all can put your responses in the Q&A section or in the chat section. How many of you have a website that you're happy with? How many? So if you have a website, let's say that gets, and you have a marketing agency that converts, that sort of brings in thousands of people to your website, are you happy with the conversion rate, which is if you get 10,000 or 5,000 visitors on your website, how many people actually go online and request an appointment, right? It's very similar to getting phone calls and how many calls are being answered. One of the biggest challenges that we heard from our customers was that, hey, I have 2,000 visitors, but only 20 to 25 people every month request an online appointment, right? What happens to the 1,950 others? So what we did is we gave them a conversion optimization tool that converted a lot more patients. Patients started asking a lot more questions. Now, I'll tell you why that happened, right? And what's the capability that we gave them? The capability that we gave them is a web chat to text. It's a very unique capability. It helps you grow your SMS list. Now, you might have heard of thousands of web chat softwares, but this is a web chat software that's very unique. What this does is, as soon as patients come onto your website, they can open the web chat, initiate a conversation, and when they do that, they'll receive a text message, and they can drop off the website. They don't need to stay on the website anymore, right? they'll get an SMS and they can continue the conversation via SMS. So your front desk does not have to respond in real time. So that's the web chat to text capability, right? And let me show you how that works. Sorry. Basically, this is how it looks on your website. Patients can come and choose the location and drop in a message, right? Now, let me tell you why this works better than contact us forms, right? Because contact us forms are not conversational in nature, right? They just fill in the details, somebody gets back to them. Whereas this web chat to text is conversational in nature, it converts this into a text message conversation. So that's essentially the fourth and the most important channel to sort of convert your website visitors better. On average, we've seen 90% response rate. That's the business impact that has happened, right? And about 70 seconds lesser. Basically, the average response time to these 95% chats is 70 seconds or lesser, right? Patients respond in 70 seconds or lesser because they are via the text message, right? So those are the 4 ways you can acquire new patients. While our software has a lot many ways to acquire new patients, I focused on the most important ones, but happy to talk more about the other capabilities, right? Now let's go into retaining existing patients. But before we do that, let's understand why it's important to retain patients, right? Today, the cost of acquiring new patients is 5x more than it was a few years back. The cost of running an ad on Google is going higher and higher. The cost of running an ad on Facebook is going higher and higher. You have competition right next door. You have practices opening up everywhere, right? So that's why it's important to retain existing patients, the ones that you've acquired with a lot of dollars spent on marketing, right? So let's talk about that. Let's talk about the first capability that we have, which is automating annual wellness patient reactivation. Now, when we started working with this practice, they did not have a way to automatically follow up with patients for, in the dental industry, for example, recalls, and they did not have a way to automatically follow up with patients who were due for their annual wellness check, or even patients who were overdue, based on the visit type. What we did is we essentially automated the annual wellness patient reactivation for them, because what they were doing is they were picking up the phone, sending out emails, requesting patients to come back for their annual wellness check, right? How we did this is, let me show you how we did that. We essentially sent out a text message automatically when we read in their EMR that a patient is due or overdue for an annual wellness check, right? So exactly how you see on the system, it says, hello, it's time for your biannual check. Check in, schedule your appointment using this link, right? So it made it a lot more easier to schedule appointments because we also offer online scheduling, right? So not only we allow patients to text, we also allow patients to book appointments online. We've seen a reduction in the number of phone calls drastically with also the online scheduling, because now patients don't have to talk to a receptionist, right? They can just go out there and schedule. Receptionists can focus on the most important things: claims, greeting patients, keeping the relationship, on so on and so forth, right? The result that this generated, there was a 60%, on average, the medical practice experienced a 60%, basically, sorry, this is the no-shows, right? Sorry, let me go back. The result that they experienced was 100% automation of annual wellness program by visit type, right? And it increased, there was a 30% increase in patient re-engagement for patients who were inactive for the last 12 months, right? In addition, it generated about $10,000 in net new revenue every month. So that's about $120,000 in additional revenue generated by automating patient reactivation, right? So that's essentially how you can retain your patients. Now let me go to the second way you can retain patients, right, which is no-shows. Even after all the efforts to send out reminders, to automate reminders, to call patients, what was happening was that there was still 10% leakage. What I mean by 10% leakage, right? 10% of the patients were still canceling appointments last minute. So it was a last minute cancellation that was happening, right? So imagine this scenario. You send out a text message, you send out an email, patients confirm their appointment, but last minute something comes up. 10 out of the 100 patients don't show up. You lose revenue twice because one, you lose that slot, it goes empty. Two, you also, there's a high chance you probably do not have a system to follow up automatically, but you also have to accommodate that patient somewhere else, right? So you lose 2 slots. Now, what was happening with essentially this practice, right? On average, the medical practice experienced a 60% loss in customer lifetime value by not following up on no-shows. what was happening was whenever there was a no-show, there was no automated way to follow up, right? The only way to do that was manually picking up the phone, manually sending out a text message, manually sending out emails, right? Which didn't happen, obviously, all the times, because it's not necessary that the receptionist is always free, the office manager is always free to follow up, right? Automation is the key. What we did is essentially, let me tell you what was the other business challenge, right? Like I said, 80% of the no-show follow-ups were through traditional channels, and 35% of these patients were lost due to avoidance of no-show follow-ups, right? So let me ask you this question. How many of you do an automated follow-up whenever there is a no-show? I'm sure it's next to impossible, or there are no metrics that you keep a track of that if we had, let's say, 100 no-shows this month, we followed up on all of them, all 100% of them, right? So that's exactly the challenge that they were facing. What our system with automation did is it automatically followed up on no-shows this way, right? So, for example, it sent out a text message saying that, hey, you missed your appointment with Dr. P. Sherman at 2 p.m. Please book another appointment using this, right? So they could easily do that. So that's essentially how we were able to automatically follow up on no-shows as well, right? The business impact that it created was that with immediate follow-ups on scale, the immediate alternate booking went up by 70%. So if you had 100 no-shows, 70 of those 100 no-shows rebooked appointments automatically without anybody having to follow up, right? Overall customer retention and loyalty improved by 30%. So just imagine you had a no-show and you didn't have to follow up on that because the system automatically followed up. So those are two ways in which you can retain your existing customers, right? Automating reactivation, automating follow-ups on no-shows so that you don't lose these patients to someone else. Of course, like I said, we do have a lot of other methods to help you retain patients, which is something that I can definitely take offline. But these were the two most important things. So just to quickly recap, we've spoken about two most important goals: acquiring new patients, retaining existing patients, right? Let's come to the third goal of healthcare practices, which is keeping the schedule full. Now, how do you keep your schedule full, right? How do you make sure that none of your slots go empty? So let's talk a little bit about that. And why it's important. Just before I do that, let me tell you why it's important to keep your schedule full, right? Every time a schedule goes empty, you lose revenue twice. If you go and have an empty slot today, let's say at 10 a.m., not only you lose that 10 a.m. revenue, but you also lose revenue somewhere else because you got to reschedule someone, right? So it's very, very important to keep your schedule full at all points in time. And there is absolutely no way you can do that through manual efforts, right? It just does not work. Now, how you can do that with an automated system? Let's talk about one of the most unique capabilities that we built for our customers with the help of text messaging, right? Which is schedule-based texting. Now, I'll ask you a quick question, right? What do you typically do when there is bad weather and you need to close down the practice? Or what do you do if one of the providers called in sick and had 15 patients scheduled? How do you inform the patients? Do you pick up the phone, start dialing every patient one by one? If that's how you do it, that's probably, let me tell you, that's probably not the most efficient way to do that, right? And that's exactly why your schedule is not full today. That's exactly what was happening with our customers, right? 100% of the practices that we work with, except that they were manually calling in patients in case of last-minute changes to the schedule, right? If it was a bad weather, if it was rescheduled, on average, they were losing 3 hours of their productive time in case of a last-minute change. It could be bad weather. It could be one of the providers not calling in. It could just be that one of the practices is not open, so on and so forth, right? And less than 20% of the patients that they would call manually would pick up the call, right, in the first attempt, resulting in additional work. So let me tell you how we completely changed that perspective for healthcare practices, right? What we did is, what you see on my screen, this was their schedule, for example. You see a schedule on my screen. We essentially brought in their entire schedule from their EMR. So we replicated their schedule with the list of providers, and we also sort of let them see the schedule based on a week, on a day, etc. They could very easily send a text message to a set of patients by selecting these patients through a single click of a button, or they could filter patients on a specific day, specific month, specific week, with a specific provider, all providers, and with a few clicks of a button, they could send out text messages, right? So Essentially, what that means is to keep their schedule full. Whenever there was a last-minute schedule change, they didn't have to dial a phone, right? Or they didn't have to send emails. They could easily send out messages. And let me tell you what's the kind of impact that this created. This is something that all of our customers love. In fact, they also use it for last-minute reminders, right? While we do send automated reminders, which are completely customizable, our customers also love this because they're able to see on the schedule that who's already confirmed, who's not confirmed. Click on the name of the patient who's not confirmed and send them a message. Click on the name of the patient who they want to cancel the appointment for, so on and so forth, right? And the impact it created was massive, right? They were able to, of course, reduce no-shows by 90% and was able to generate 35% more organic reviews by also sending out these reviews, right? And of course, they were able to save a lot of time for their practice. So they were able to save, I can tell you for sure, that every time there was a change in schedule, they were able to change 3 to 5 hours that day by automating this text message communication, which is schedule-based. So that's the first way in which you keep your schedule full, right? The second way in which you keep your schedule full is by reducing these no-shows. We spoke about following up on no-shows that happen because of last-minute changes, which is unavoidable, right? But how do you make sure that that patients also remember their appointment, right? Apart from the last-minute changes. You do that through automated and customizable reminders, right? And that's the second capability that I'm going to talk about, which is appointment reminders, right? Now, every healthcare practice that we work with told us that, hey, my EMR gave me an appointment reminder capability, but it had many challenges. It was not customizable. I couldn't edit the message. I couldn't edit how many reminders I could send. I didn't have a way to funnel patients into who's confirmed, who's not confirmed, and customize my messaging, branding, etc., right? That's exactly what we did, right? We said that, all right, we will help you change your reminder strategy altogether. You can decide how many reminders you want to send, when do you want to send them, where do you want to send them. If somebody's still not confirmed last minute, you can essentially make an automated call and remind them of their appointment, right? But let's talk about why do these really matter, right? On average, a mere 5% reduction in no-shows can result in an additional $50,000 worth of revenue, right? So that's a huge number, right? And on average, any medical practice in the US has 18% no-shows, right? Which translates to 2 hours of daily productive time lost. So, which is equivalent to about $120,000 worth of revenue lost, right? That's exactly the challenge that our customers were also facing, right? They were seeing a 25% no-show rate. They had absolutely 0% confirmations with automated email reminders. Emails don't work, right? And practice lost about 7 hours in communicating with patients, reminding them of their upcoming appointments, right? So this is not follow-up on no-shows. This is slightly different, right? So what did we do for them? We essentially automated reminders with email. What we changed is that patients did not have to log into a portal to confirm appointment, did not have to log into a portal to communicate about their changes. They could do it via text. We started sending a text message, completely customizable reminder. The moment a patient would say yes, we would write back that confirmation into the EMR. Again, a completely automated way, right? The front desk doesn't have to make a call and does not have to manually write that confirmation. So that's essentially how the reminders worked. The business impact that it had, the overall no-show rate went down to 11%, which I said exactly, you still have about 10 to 11% leakage due to last-minute changes, from 25% in no-shows in 3 months, right? With an average revenue of about $300 per patient, the business revenue went up by about $18,000 a month. Right? And of course, there was 20% improvement in patient retention, right? So those were exactly what the numbers that the practice was able to see. Now I'll come on to the last way you can essentially keep your schedule full, right? Let's assume that there's still a last-minute cancellation that happens. How would you typically, so let's assume somebody calls in and says that I'm not able to make it because I need to reschedule my appointment, I have something personal come up. We essentially, what we did is we offered our customers a fast fill capability. Just the way when you go to a restaurant and the restaurant tells you that, hey, you have 45 minutes waiting time, but if something opens up earlier, we'll send you a message, right? That's exactly what we did for these practices. We booked patients as per our schedule, but if any patient said that if there's anything earlier that opens up, and if we had a last-minute cancellation, if the practice had a last-minute cancellation, what we would do is we would use fast fill lists, and the fast fill list would automatically send out a text message allowing the patient to confirm that they would want to come in earlier because an earlier slot has opened up, right? So that's essentially what we did. And the last capability that I'll come to is essentially online scheduling, which will help you keep your schedule full, right? Today, customers go onto Amazon, go onto a lot of different platforms and book products online by filling out a form. They don't have to pick up a phone to order something, right? Why do they need to do the same thing with the dental practice, with the healthcare practice? They should not be needing to do that, right? It's already becoming a commodity. That's exactly what we did for our healthcare practices, and that's the most important way in which you can keep your schedules full. What we did is we offered them an online scheduling capability, right? And what it did is it allowed patients to go onto the website, go onto a link, and book an appointment easily, right? They didn't have to pick up the phone and speak to a receptionist. They could just go online, see the schedule, see the provider, see the services they wanted, and book an appointment. That's how easy it was, right? What our practices saw was an average experience, a 20% increase in direct bookings. So if you were seeing, let's say, for example, 100 bookings a month, you would start to see 120 bookings, right? That's exactly what happened to them. 2 hours of their daily productive time was saved, in a lot of cases a lot more, because now the receptionist did not have to pick up the phone for the appointments that did not really need any special services or answer any special questions to be answered, right? And 35% of our clients feel that online scheduling option has a positive impact on their patient's experience. Patients love it, right? Nobody wants to talk on the phone. So that's essentially what online scheduling does. Now let me show you how exactly online scheduling works, right? It's as simple as this. Step one, patients can go onto the website. They can select what type of appointment they would like to schedule. When they click on that, it will show them a list of all the providers and when are those providers available. That's step two. And then they just have to fill in their details. That's step three. Step four, they get a confirmation. They get a text, email confirming their appointment, and then the reminders sort of follow on, right? As easy as that. A patient can book an appointment in literally under 2 minutes instead of having to pick up the phone, wait on the line, talk to someone, so on and so forth, right? And of course, I don't think I need to talk about the impact, but that's essentially the impact that it created, right? So today, what we've learned is how you can acquire new patients, you can retain existing patients, and also keep your schedule full with the help of automation. And the only way to do this is going multi-channel. Today, some people are on social, some are on text, some are on email. You can't just follow phones and emails, right? While we do offer a phone system as well that integrates with your EMR to give you better insights into how many calls are being answered, how many calls are converted into patients, so on and so forth. But I'm a big believer that text messaging is the next email, right? So we're essentially relying on the next email, the next email of the world to sort of communicate with customers, right? Now I'll go on to the last two slides before I go into the poll. Basically, what we've seen with that life with and without automation, right? Without automation, you got to keep making phone calls, one call at a time. You got to miss calls. You have to request reviews manually and send out manual review reminders, right? With automation, you can automate all of that, right? And customers really love it. So automation is the way to go. Digitization is the way to go, right? And healthcare practices are quickly getting there. This is something that I'll sort of skip for today, but I would tell you for sure that with automation, you will essentially easily grow your business by 2x, right? Automation comes at a much lesser cost than the front desk. It's essentially an additional front desk at a much lesser cost so that your front desk team members can focus on the most important things, right? So that's essentially how we work. Now, we do have a poll for today, and I'll sort of, for each poll, I'll spend about 45 seconds so all of you get enough time. And we are just about, we had the last 15 minutes for question and answers, and I see that, there are a lot of questions, so we're just around the time, but I'll go on to the poll question, and I would request everybody if they can give their inputs in the poll questions, right? So the first one is, what EMR do you currently use? I'll sort of hold on here for about 15, 20 seconds so that all of you can see which EMR options do we have so that you can essentially answer your, select the, basically select which EMR you work with today. And of course, we'll take up the questions that we have. And if you have any questions, do use the Q&A section that you see to ask any questions that you have. All right. I'll go on to the next one to see the poll results. We just have 3 exciting questions for the poll. Let me go on to the next one. Okay, looks like people are still answering. Should I still go back? Let me go back. If you still want to take maybe 5 more seconds. All right, so I see that 17% people say eClinical works, and 8.6% people say Athena Health, and then there is Epic, there's Cerner. That's exciting. We integrate with all of these. And I do see Israel, there's a question, is it over? Yeah, it's just about to get over, probably 10 more minutes, right? All right, let me go to the next poll question and understand a little more. So basically what we're trying to understand is, what is your current no-show rate? Do you know your current no-show rate? And if yes, or if you have a wild guess, then if you can sort of, pitch in your answers, then let's look at where we are today and how much automation is needed, right? So I'll hold on for 10 seconds to see what is the current no-show rate at the practices that are attending today, right? All right. And if you don't know the answer, then you should definitely get in touch with us, right? Okay, so 0 to 30%, 77%, that's great. 30 to 50%, 22% practices, right? I think you definitely need a little more automation, a little more strategy around that. For anybody who said 0 to 30%, if it's closer to above 20% or even 10%, then you do need to sort of revisit the strategy, but you're still probably a little better than 30 to 50%, right? All right, the last question for today on the poll is, can you reliably predict how many new reviews your practice will generate every week? And this is extremely important for you as a business to reliably predict, right? So that Google keeps recommending you to more and more patients. So let's hold on for 5 more seconds, and then we'll jump onto the question and answer session. I see there are a lot of questions. Okay, I see 88% respondents say they do not know how they can reliably generate more reviews, right? It's extremely important, and I cannot emphasize, I'm happy to sort of talk to everybody. They can reach out to me. I'm happy to talk to everybody who would want to know more about this, right? All right, so I really appreciate everybody taking out the time. If you would like to get in touch with us and learn more about our software and what we've done, you can reach out to me directly on anmol@emitrr.com. It's EMITRR. A lot of times customers get confused. You will, of course, receive the recording after this, but you can reach out to me. You can go to emitrr.com, request the demo, right? EMITRR.com. Or you can text or call us on 210-941-4696. It's as simple as that, right? So again, if everybody's taken down these details, we'll jump right into the question and answer sessions, right? Great. So let's jump into the question and answer session. Marcus, would you want to take up the question and I can answer them?
Absolutely, yeah. We'll go ahead and jump in, and you can continue to submit any questions you have by typing them into the Q&A chat box on your webinar console. First question we have is, how do you analyze customer complaints or feedback?
Got it. So there are multiple ways, right? Like I said, our product has a lot more capabilities, which we didn't sort of focus on here. But you can analyze customer complaints even through the reviews capability that we have. We help patients leave private feedback when we ask them for review, in case they had any feedback or customer complaint. At the same time, we have surveys, right? So you can survey patients, understand their feedback, and they can also leave you text messages, right? Happy to talk more about it offline as to how our customers have employed a strategy to collect customer complaints, right? Essentially, when we send out an automated review request, we also ask them for feedback. So that feedback goes into the system, you can analyze that, right? And surveys, of course, help you analyze the pattern. That is, everybody, are people happy with the practice, with the front desk? with the provider, so on and so forth. So we help with both of those.
Perfect. Thank you, Amal. Next question we have, how do you best overcome the opt-in requirement for texts to incorporate them to a greater degree in your Marcom strategy?
Great. So I think that's a great question. How do you sort of best overcome the opt-in requirement for text to incorporate them? There are a lot of different ways we do that, right? I can tell you how we do that. Let me give you one or two examples, but again, happy to take this up in further detail offline. When we send a review request, we also sort of ask them, do you want to hear from us via text? They can opt in. When patients leave a web chat request on the website, we ask them to opt into the text messaging communication, right? There are a lot of different, so it's a multi-channel communication capability, right? Across all the current communication that we have, we give them the option to opt in proactively, right? So essentially when someone goes onto the web chat, initiates a query, we tell them that, hey, we've sent you a text. We also tell them opt in to hear from us about, let's say, communication about your appointment or promotion, so on and so forth, and they can opt in there, right? The same thing we do when we send out review requests or we send out surveys, right? We tell them that, hey, opt in to hear about future communication, right? So that's something that I can talk to you about. We've seen great results there, right? But we do that automatically through our system.
Perfect. Next question we have. Do you find that some staff decided to stop answering the phone so that they could just respond to a text?
Sure. I think that's a great question. I'll probably tell you on the other side of things, right? Not the staff, but we've seen patients, right? They don't like answering phones, right? So they don't. What we've seen is a lot of time patients don't answer phone calls for, let's say, payments, or they don't answer the phone call for a reminder. They don't answer the phone call for a review. But the moment the practice sent a text message, they answered it, right? So I've never seen staff decided to stop answering phone just so they could respond to the text. But I've definitely seen that happen at the patient end, right? But that's a great question, and we can definitely look at that to see if staff is doing that. At least so far in my experience, I've never seen that, right?
All right. Next one we got. Where are the phone numbers coming from?
Wow, that's a great question. To tell you how, this is a great question because this is exactly what we do, right? We use your current phone line. So if you have a phone number, be it a software, a landline, your own mobile, we use the same phone number to send a text message. So we text enable your landlines, text enable your current numbers. You don't need new numbers because patients are already sort of, I would say, patients are already, accustomed to a certain number. And I can tell you for sure that it's very highly likely that patients are already assuming that number is textable number and texting you, right? So that's essentially what's already happening. So I would, the numbers essentially are your current numbers. You don't need new numbers.
All right, easy enough. Next one we got. How do you operationalize suggestions for online scheduling for a specialty clinic like heart and vascular, especially with testing being required for many of these patients?
That's a great question, right? So what we essentially do is you can operationalize consultations, right? Or we did see that happen to some of the medical practices. I'm happy to discuss more about your specific use cases, but essentially the way our systems are set up is you can define and customize exactly the type of appointments you want to show there, right? For example, you said that testing is required. So after the testing is done, or for the testing, you can have a specific appointment type. You know the testing takes, let's say, 30 minutes. So they can block a 30-minute slot. Whereas you know that a surgery might take 3 hours. Although, of course, we wouldn't expect people to book online surgeries. But you know maybe the consultation will take 15 minutes. So the way our system is set up, that you can go in there and customize the type of appointments. Patients can select that appointment and block equivalent time on your EMR, right? Of course, I'm happy to understand this in more detail. I'm very sure that there is a solution to this, but happy to understand this in more detail offline, Amy.
Right, we have time for one, maybe two more. Does someone have to always be available to monitor the website chat?
So the advantage here is that they do not have to be available always to monitor the website chat because we convert this into a text conversation, right? That's exactly what was happening with practices. Patients would come onto the website, open the web chat, leave a message, waiting for the response on the website and never get a response, right? Because you're not always available in real time. So we converted into text, converted the message into text. Patients can walk away. Whenever your teams are available, they can respond, right? So that's essentially how they can do it.
All right, we've got another question here. How does your practice and MD reviews compare to ZocDoc? Why choose your company over ZocDoc if we want to improve reviews?
Absolutely. So let me tell you two ways we differentiate from ZocDoc, right? One is ZocDoc charges you for every referral. We don't do that. You have your own brand, your own online scheduling. You don't pay us for every scheduled appointments, right? Just the way you do it with ZocDoc. ZocDoc runs on Google. Google is much bigger than everybody else. We drive reviews to Google, right? Google directly, Facebook. Of course, we do drive reviews to Healthgrades, etc., all industry-specific websites. But very rarely do patients go onto ZocDoc to book appointments. And like I said, there are two advantages, right? You have control over the patients. You don't pay ZocDoc. You don't pay us like the way you pay ZocDoc. And directly, patients book directly. In addition, the reviews don't come to us. Reviews go to Google. We are driving reviews to Google. So if you want us to drive reviews to ZocDoc or Healthgrades, we can do that as well.
Okay, and I think this might be the last one we have time for. One audience member wants to know if they can get a list of EHRs your system is compatible with for those that answered the other category.
Absolutely, you can get a list. So Tiffany, you can definitely get in touch with me. I can share with you the list of EHRs that we integrate with. But just to give everybody a heads up, we integrate with 500 plus EHRs today, right? So very likely that we already cover the EHR that you work with, right? And we work in US, Canada, even Mexico, etc., right? I know there are more questions, but I think, Marcus, we don't have the time for more questions, right?
Yes, we are running into time, but I want to go ahead and thank our speaker, Mr. Anmol Oberoi, for an excellent presentation and for Emitrr for sponsoring today's webinar. To learn more about the content presented today, please check out the Resources Center on your webinar console and fill out the post-webinar survey. Thank you for joining us today, and we hope you have a wonderful afternoon.